What is cluster headache? Cluster headache, or CH, is a neurological disorder characterized by recurrent severe headaches on one side of the head, typically around the eye. There is often accompanying eye watering, nasal congestion, or swelling around the eye on the affected side. These symptoms typically last 15 minutes to 3 hours. Attacks often occur in clusters which typically last for weeks or months and occasionally more than a year. The cause is unknown. Risk factors include a history of exposure to tobacco smoke and a family history of the condition. Exposures which may trigger attacks include alcohol, nitroglycerin, and histamine. They are a primary headache disorder of the trigeminal autonomic cephalalgias type. Diagnosis is based on symptoms. Recommended management includes lifestyle changes such as avoiding potential triggers. Treatments for acute attacks include oxygen, or a fast-acting trepan. Measures recommended to decrease the frequency of attacks include steroid injections, Sivamide, or Verapamil. Nerve stimulation or surgery may occasionally be used if other measures are not effective. The condition affects about 0.1% of the general population at some point in their life, and 0.05% in any given year. The condition usually first occurs between 20 and 40 years of age. Men are affected about 4 times more often than women. Cluster headaches are named for the occurrence of groups of headache attacks, or clusters. They have also been referred to as suicide headaches. Cluster headache signs and symptoms. Cluster headaches are recurring bouts of severe unilateral headache attacks. The duration of a typical cluster headache attack ranges from about 15 to 180 minutes. About 75% of untreated attacks last less than 60 minutes. However, females may have longer and more severe cluster headache. The onset of an attack is rapid and typically without an aura. Preliminary sensations of pain in the general area of attack, referred to as shadows, may signal an imminent cluster headache, or these symptoms may linger after an attack has passed, or between attacks. Though cluster headache is strictly unilateral, there are some documented cases of side shift between cluster periods, or, rarely, simultaneous within the same cluster period, bilateral cluster headaches. Cluster headache pain. The pain occurs only on one side of the head, around the eye, particularly above the eye, in the temple. The pain is typically greater than in other headache conditions, including migraines. The pain is typically described as burning, stabbing, drilling or squeezing, and may be located near or behind the eye. As a result of the pain, those with cluster headaches may experience suicidal thoughts during an attack, giving the alternative name, suicide headache, or suicidal headache. It is reported as one of the most painful conditions. Cluster headache. Other symptoms. The typical symptoms of cluster headache include grouped occurrence and recurrence cluster of headache attack, severe unilateral orbital, supraorbital, and/or temporal pain. If left untreated, attack frequency may range from 1 attack every 2 days, to 8 attacks per day. Cluster headache attack is accompanied by at least one of the following autonomic symptoms: drooping eyelid, pupil constriction, redness of the conjunctiva, tearing, runny nose, facial blushing, or sweating. Typically appearing on the same side of the head as the pain. Restlessness, for example, pacing or rocking back and forth may occur. Similar to a migraine, sensitivity to light, photophobia, or noise, phonophobia, may occur during a cluster headache. Nausea is a rare symptom, although it has been reported. Secondary effects may include the inability to organize thoughts and plans, physical exhaustion, confusion, agitation, aggressiveness, depression, and anxiety. People with cluster headache may dread facing another headache, and adjust their physical or social activities around a possible future occurrence. Likewise, they may seek assistance to accomplish what would otherwise be normal tasks. They may hesitate to make plans because of the regularity, or conversely, the unpredictability of the pain schedule. These factors can lead to generalized anxiety disorders, panic disorder, serious depressive disorders, social withdrawal, and isolation. Cluster headache recurrence. Cluster headaches may occasionally be referred to as alarm clock headache because of the regularity of their recurrence. Cluster headache attacks often awaken individuals from sleep. Both individual attacks and the cluster grouping can have a metronomic regularity, attacks typically striking at a precise time of day, each morning, or night. The recurrence of headache cluster grouping may occur more often around solstices, or seasonal changes, sometimes showing circannual periodicity. Conversely, attack frequency may be highly unpredictable, showing no periodicity at all. These observations have prompted researchers to speculate an involvement, or dysfunction of the hypothalamus. The hypothalamus controls the body's biological clock and circadian rhythm. In episodic cluster headache, attacks occur once or more daily, often at the same time each day for a period of several weeks, followed by a headache-free period lasting weeks, months, or years. Approximately 10 to 15% of cluster headaches are chronic, with multiple headaches occurring every day for years, sometimes without any remission. In accordance with the International Headache Society diagnostic criteria, cluster headaches occurring in 2 or more cluster periods, lasting from 7 to 365 days with a pain-free remission of 1 month, or longer between the headache attacks, may be classified as episodic. If headache attacks occur for more than a year without pain-free remission of at least 1 month, the condition is classified as chronic. Chronic cluster headache both occurs and recurs without any remission periods between cycles. There may be variation in cycles, meaning the frequency and severity of attacks may change without predictability for a period of time. The frequency, severity, and duration of headache attacks experienced by people during these cycles varies between individuals and does not demonstrate complete remission of the episodic form. The condition may change unpredictably from chronic to episodic and from episodic to chronic. Thanks for watching our video. Make sure you subscribe to receive more video related to cluster headache symptoms, cluster headache treatment, and many other everyday health and wellness. Thank you so much for watching.